Welcome to the Health Services Change Guide, People's Needs Defining Change. What is the Health Services Change Guide? The Change Guide is the agreed policy and framework on change in the health service. It is a step-by-step guide that will help you to lead change with a focus on people and culture. It features practical advice from practitioners, leaders, service users and staff. You will also find evidence to support the approach. People are at the centre of all of our initiatives. The Health Services Change Guide focuses in particular on people's needs defining change. It provides guidance on working with service users, families, citizens, communities, and staff to understand their needs better while undertaking change. It can be used at all levels to support managers and staff. It's a roadmap to help us all improve how we deliver positive change. Why would teams use the Change Guide? It increases your chances of success by providing all the help you need to carry out change and improve services, guiding you on how best to work with service users, families, and staff to understand their needs, value their experiences, and design service improvements. It simplifies change in a complex system by recognizing the importance of working with people in their own situation to design and deliver change that meets their specific needs and local context, providing an opportunity to connect change and service improvement initiatives at local and national level. It helps people to do change well by helping teams to develop their ability to carry out change initiatives with confidence, guiding you through the change process in detail with lots of helpful resources. Let's hear from healthcare staff about using the Change Guide and framework.
For me, the People and Culture Change platform provides the framework and the signposts for how do we do this well. One of the main concepts that I'm taken by with the PCCP is the idea of co-production. Co-production for me is essential to designing service improvement projects and service delivery projects that are fit for purpose and serve the needs of our patients.
Change is a part of all our lives. Working in health and social care means responding to rapid emergent change, and that isn't always easy. The Change Guide and e-learning programme have been created for you and I and all of us working across the organisation to help us to do change well together. This means putting people at the centre of the work we do, co-designing change with patients, service users and colleagues to create the right care delivered at the right time and in the right way.
The Change Guide helped us in many, many ways. And one of the ways we found really good was it really made us reflect on how we were going to introduce this change before we even started. And this was a completely new way of working for us. And we found the section on communication and engagement particularly good. And then we were engaging with other people outside of our own service, like a dietitian, geriatrician, and we needed help with the pathway. And this whole approach from the guide really made us think much more about the people, in fact the physiotherapy team and everybody involved.
The structure of the Change Guide was very useful, particularly the idea of early co-designing, where we would go to a staff meeting with a piece of work that we had done and we would ask the views and the opinions of our colleagues. We welcomed these views, we had honest communication, and all of that helped us to refine the design and added to it. What was most helpful to us as a team at the design phase was the structure of the Change Guide taught us a collaborative way of change management. So all of the stakeholders were involved and all of the team were involved. Also, the fact that it isn't, even though we were moving forwards, it isn't a linear process. We were going backwards and refining work that we had done previously, while all of the time moving forwards in a very positive way.
The People and Culture Change platform provided really useful tools. One of them would have been how to assess the readiness of people that are going to be involved in your change project. For me, this gave me a template that set out some performer questions, and it let me ask certain key questions of people across the project and let them express where they felt maybe there were still some issues that they felt they weren't quite ready for, and it let me measure that then across all the people that are involved in the project. So that template, the readiness factor template, allowed me to listen to what people had to say about where they were in that particular point in time on the project.
For me, the People and Culture Change platform provided the foundation for a successful project by allowing us to reflect on our project and to consider areas that we may not have considered previously. It allowed us to think about the things we had done well, and I feel that it provided us with great guidance and support along the way. As clinicians on the ground, we need to balance, I suppose, our time between clinical role and service improvement role. And the Change Guide really helped us with that and provide us a
The Health Services Change Guide, resources to deliver change and improvement online and in your hands.